Nephrotic syndrome, causes and symptoms. Nephrotic syndrome is a group of symptoms that indicate that the kidneys are not functioning as they should. Nephrotic syndrome can result from the diseases that affects just the kidneys or the entire body. It can occur in both adults and children. According to the National Institute of Diabetes and Digestive and Kidney Diseases, diabetes is the systemic disease that most commonly causes nephrotic syndrome, while focal segmental glomerulosclerosis or FSGS is a kidney-related condition most likely to cause it. In this video, we look at what nephrotic syndrome is and its causes and symptoms. What is nephrotic syndrome? The National Institute of Diabetes and Digestive and Kidney Diseases state that nephrotic syndrome occurs when tiny blood vessels in the kidneys, called glomeruli, are not working properly. The glomeruli normally act as filters, removing water and waste molecules from the blood and sending them to the bladder in the form of urine. These vessels also allow blood cells and large molecules such as proteins to stay in the blood. When the glomeruli become damaged, protein may be able to seep through the filter system into the urine. Nephrotic syndrome involves the following signs: albuminuria. High levels of protein are present in the urine. Hypoalbuminemia. There are low levels of a protein called albumin in the blood. Hyperlipidemia. There are elevated levels of fat and cholesterol in the blood. Damage to the glomeruli also may cause a condition called nephritic syndrome. As with nephrotic syndrome, the symptoms of nephritic syndrome include protein in the urine. However, the protein levels are usually not as high as they are in nephrotic syndrome. A person with nephritic syndrome may also notice blood in the urine, which is not a symptom of nephrotic syndrome. Symptoms. The symptoms of nephrotic syndrome include swelling or edema, typically in the ankles, feet or legs, fatigue, loss of appetite, weight gain, foamy urine. The foaming that occurs due to the presence of protein in the urine is different than the bubbles that a person may notice in normal urine. A 2019 article in the Clinical Journal of the American Society of Nephrology states that the foam appears as layers of small to medium bubbles that do not disperse easily. In contrast, normal urine may contain a single layer of larger bubbles that soon disappear. People with nephrotic syndrome might first notice swelling or edema in their legs after standing for a long time, or puffiness around their eyes after waking up. As the condition progresses, the person might find that their legs are always swollen or notice swelling in other parts of the body. Causes. Healthcare professionals classify the cause of nephrotic syndrome as either primary or secondary. The National Institute of Diabetes and Digestive and Kidney Diseases define these terms as primary. Primary causes of nephrotic syndrome are conditions that only affect the kidneys. Examples of primary causes include FSGS. In FSGS, scarring occurs in portions of the glomeruli. FSGS occurs more frequently in males than females and has a higher prevalence among African American people. Membranous neuropathy. Immune complexes build up in the glomeruli, causing damage. Minimal change disease or MCD. The damage to the glomeruli is only visible with a very powerful microscope. Minimal change disease is the most common cause of nephrotic syndrome in children. In adults, allergies, infections, or certain medications may cause minimal change disease. Membranoproliferative glomerulonephritis or MPGN. The immune system attacks cells in the kidneys, damaging the glomeruli. Sometimes another disease such as hepatitis C causes membranoproliferative glomerulonephritis. Secondary causes are conditions that affect the entire body, resulting in nephrotic syndrome. Some examples of secondary causes are diabetes, systemic lupus erythematosus, infections such as hepatitis B, hepatitis C, or HIV, cancers such as Hodgkin disease. Is nephrotic syndrome curable? The National Institute of Diabetes and Digestive and Kidney Diseases state that nephrotic syndrome may resolve once a person has treated the underlying cause. For example, minimal change disease rarely results in kidney failure, and most people recover and avoid relapses. However, some other conditions that cause nephrotic syndrome are chronic and may progress over time, such as diabetes. A person should see a healthcare professional to create a treatment plan. Complications of nephrotic syndrome often result from the loss of certain proteins in the urine. The body may need these proteins to fight infections or control blood clotting. Other nephrotic syndrome complications may include coronary artery disease, high blood pressure, anemia, which is when a person does not have enough healthy red blood cells, hypothyroidism, which occurs when the thyroid gland is unable to produce enough thyroid hormone, temporary loss of kidney function. Diagnosis. In addition to a physical exam and medical history, a doctor will typically diagnose nephrotic syndrome using the following test. Urine test. This test looks for elevated levels of protein in the urine. Blood test. This test may reveal the levels of albumin, cholesterol, and other blood components. Kidney biopsy. A doctor might request a biopsy to look for microscopic changes in the kidney. Ultrasound. Doctors sometimes use this type of imaging to see whether the kidneys look normal. When to see a doctor? Someone who is experiencing symptoms of nephrotic syndrome, such as foamy urine, loss of appetite, and edema, should contact a doctor. They should also contact a doctor if their symptoms get worse or new symptoms appear. Nephrotic syndrome is a group of symptoms that can indicate kidney damage. The signs and symptoms typically include swelling, fatigue, foamy urine, large amounts of protein in the urine, and low albumin levels, and high cholesterol levels in the blood. Pinpointing the cause of the condition will help doctors determine the best course of treatment.